Welcome back to Sleep Better TV. I'm Tasia Custodi, and my guest today is Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio. Thank you for joining us again, Dr. Slabach.
Thank you for having me.
So let's talk a little bit about diabetes and OSA. How is diabetes associated with obstructive sleep apnea?
First of all, the studies don't come out and say that OSA causes diabetes or diabetes causes OSA. There are some studies where they have induced sleep restriction, sleep deprivation, like what happens with obstructive sleep apnea. And what they found were that the healthy volunteers that volunteered for the study, when they were subjected to sleep restriction, their blood glucose, their blood sugar levels went up, their insulin resistance levels went up, much like in a diabetic patient.
So how common is OSA in people that have diabetes?
Depending on what literature study, it's well over 50% of patients with diabetes also have obstructive sleep apnea.
And what effect does the treatment of OSA have on diabetes?
There was a study about 2 years ago where they took diagnosed obstructive sleep apnea patients, made them adhere very strictly to wearing their CPAP, which is the most common treatment for obstructive sleep apnea. And what they found were that their morning glucose levels were lower than if they weren't being treated for their OSA. Even though there aren't any studies right now out there about surgery or oral appliances, we can kind of make at least a correlation that treating obstructive sleep apnea also helps with managing blood glucose levels and diabetes.
Thank you so much for your time today.
Thank you.
My guest today has been Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio, and you have been watching Sleep Better TV.